So today's topic is micromineral iodine. Those who have the textbook, please mention the page number in the chat box. Page number 256, those who have the textbook, it's page number 256. If anyone is joining late, please help them out with the page numbers. Chapter 13. So iodine, it is a trace element, okay? You don't require it too much in number, okay, on a daily basis. It's a mineral that is naturally found in earth soil and even in ocean waters, okay? But it is important for you to get enough amount of iodine in your diet, okay? The food, plants that grow on soil, they also have iodine, but that cannot be absorbed by the human system, okay? You cannot depend on the plants that grow on soil or even the seafood that comes from the ocean that is giving you enough amount of iodine. You can't depend on that, okay? You have to take iodized salt. Fortified iodized salt has to be taken. And even if you are using pink salt or black salt, any form of salt, make sure it is an iodized one, okay? Even if you are using a raw form of raw rock salts and all, they are not fortified, okay? So you have to ensure that you are taking fortified iodine iodized salt in your diet as well, okay? So it is added to many various, earlier it was just table salt in which fortification was done. But now, since there is an emergence of different types of salt, okay, like pink Himalayan salt, rock salt, okay, the different kind of salts are being used. So those are also getting fortified, okay? And even as a dietary supplement, only under doctor's prescription, iodine as a dietary supplement is also prescribed, okay? So your total body contains around 15 to 23 microgram of iodine, and 80% of that is present in your thyroid gland, okay? Remaining is in your blood, okay? Some get stored in your muscle, in your saliva, and ovaries also, okay? But majority is in your thyroid gland because it is required, iodine is required to produce thyroid hormones, okay? If your iodine levels are low, then you will be using supplements. Otherwise, you don't require supplements. Don't just jump into taking supplements. Only when your iodine levels are extremely low, doctor will recommend you to use the supplementation. Without checking the doctor, do not self dose yourself with iodine, okay? Otherwise, it may lead to toxicity. So function, the most important function of iodine in your body is the synthesis of thyroid hormone, production of thyroid hormone. Triiodothyronine, that is T3, okay? It has 3 iodine components. That's why triiodothyronine, okay? And tetraiodothyronine, it has 4 iodine component, okay? So it is tetraiodothyronine. These are the 2 major hormones that influence a lot of your metabolic functions, growth and development, okay? If you have, I guess last week in Wednesday session, disease session, we took class on thyroid disorders. Am I right? Last Wednesday. The last week, I think we have done thyroid disorders. So the function, how these 2 hormones, T3 and T4, helps in the metabolism of protein, carbohydrates, fats, okay, glucose, different forms of metabolism, how they help, okay, different systems, reproductive system, cardiovascular system, your neurological system, digestive system, different systems are getting affected by thyroid hormones. Different macronutrients and micronutrients metabolism is also affected by these two hormones. Okay, so they are a very important, these two are very important hormones in terms of your overall metabolism, growth, and development. Okay, iodine plays a very vital role in thyroid health. And also to make this thyroid hormone, your thyroid takes up iodine in very small amount, not in large amount. Okay, without iodine, thyroid hormone production will not happen, it will decrease. And even if your thyroid gland is underactive, okay, that can also lead to a condition called hypothyroidism. Okay, very common. Hypothyroidism is rather more common as compared to hyperthyroidism. When your thyroid is not functioning properly, that is more commonly seen. Okay, mostly in women as compared to men. Okay, hyperthyroidism, when your thyroid is overactive, okay, that is also another end of the spectrum, but that is not as common. Okay, so functions of iodine, it helps in the synthesis of T3 and T4 that we have discussed just now. Okay, it also reduces your risk of developing goiter. Goiter is enlarged thyroid gland. Earlier, goiter was we consider as iodine deficiency disorder, but now it has changed. Now we have IDD, capital IDD, iodine deficiency disorders. It's a spectrum of diseases, not just goiter. Okay, goiter is kind of a symptom of iodine deficiency because your thyroid gland is enlarged. That is a symptom. Okay, that we cannot call it as a disease per se. Okay, so we have a spectrum of diseases. We'll see that later. It also helps in the production of your sex hormones also. So it is essential for reproduction. Okay, iodine is used in ovaries, okay, for the production of hormones. So for reproduction also, to help to maintain your reproductive health, it is important. Your nervous system, okay, that is your brain, increase the brain cell proliferation. The more number of brain cells you have, the more will be your cognitive development, your intellectual development. Okay, in a growing child's case, okay, a child who is growing, who's in a growth phase, should not lack iodine in their diet. Okay, otherwise it will affect their cognitive development. Iodine also helps in converting beta carotene into vitamin A. Beta carotene is a form of is an inactive form of vitamin A that you get from vegetarian sources. Okay, it has to be converted into active form of vitamin A so that your body can store it. Your body cannot store beta carotene. Okay, only it will be in your blood only. Okay, it will just travel in your blood. For beta carotene to be stored in your body, it has to be converted into vitamin A. Okay, that's the active form. From animal sources, you will get the active form of vitamin A as it is. But in plant sources, you get beta carotene. It has to undergo conversion in your liver. Okay, only then your liver can store vitamin A. Okay, then synthesis of protein and absorption of carbohydrate, that is the metabolic function of iodine. Okay, to help in producing different forms of protein in your body. Okay, in that also different forms of iodine is used. Regulates the growth and developmental hormone, that is your growth hormone. Okay, how much growth hormone should be secreted. If there is over secretion of growth hormone, that is also bad. It will lead to gigantism. Okay, if you see the fighter Khalli in India, he is suffering from gigantism. Okay, So too much of growth hormone is also bad. So to regulate means how much is required. Only that amount of growth hormone should be secreted. Okay. To stimulate the metabolic rate by 30%. Majority of your metabolism depends on thyroid functioning. Okay. And healthy thyroid functioning depends on iodine. Okay. Then your normal development of your brain, even after your teenage years, okay, you have developed certain cognitive ability. Okay. You have gone through your childhood milestones and all, but still as an adult, okay, your brain development has to continue. Okay. Your memory has to continue. Okay. Memory is also the function of brain. So these things, if it has to work properly, iodine supply should be there. Okay, so these are the functions of iodine in general. And also other functions of iodine in medicine. Okay, it helps in managing overactive thyroid gland and also to treat thyroid cancer. Radioiodine. Okay, radioiodine, it is an isotope that is used in treating cancer. Am I audible to all? So radioiodine is a form of iodine. It is used especially to treat cancer, okay, especially cancer patients who are undergoing treatment, okay, radiotherapy and all. So for them, radioiodine is given orally, or radioactive iodine can be taken orally. It's a medication that can destroy some cancerous thyroid cells. Okay, thyroid cells that are cancerous in case of thyroid cancer. And usually what happens is that um, a surgery is done to remove the cancerous part of thyroid gland. A part of thyroid gland becomes cancerous, it is starting to spread. Okay, so usually surgery is done to remove that cancerous part. And after the surgery has been done, this radioactive radioiodine is given to the patient so that if at all any cancerous cells have been left back, okay, surgically you have removed a segment of your thyroid gland, but even though there is a possibility that some cancerous cells may have been left back and it can proliferate and cause more cancer. Okay, so to tackle that, this radioiodine is given. So after surgery has been done, radioiodine will be given. That will destroy the remainder of the cancerous thyroid cells. Okay. So that is the medical function of iodine. And even in pregnancy, a mother should not be deficient in iodine. Okay, because when a mother is carrying the fetus, okay, when the mother is carrying the fetus, when the fetus is developing, especially in the second month, third month of pregnancy, when the neural development has begun. Neural development means the child's neural tube, from neural tube, the child will develop its brain, spinal cord, etc. Okay, so in when we talk about a fetus, we don't like fetus who's developing, we don't usually use the term as heart, limbs, and all. Okay, there are other terms used in fetology. Okay, so neural tube is what we call as the central nervous system. Okay, neural tube has to close. Okay, only then the child will have a healthy brain. Okay, development, and then a spinal cord development. That entire neural tube becomes brain and spinal cord and into spinal cord. Okay, so during pregnancy, when the child is being developed, okay, when the neural tube is being developed, iodine is required. If the mother is deficient in iodine, the child will not have a healthy neural tube development. That means the child will not develop a healthy brain or spinal cord. That will give a rise to some neurological condition. Okay. Women who were deficient in iodine during pregnancy, there are high chance that they will give birth to a child who may have low IQ when they grow up. Okay. And they may have some other intellectual and growth milestone delays. Okay. During pregnancy also, your iodine intake has to be slightly higher as compared to a normal woman. A pregnant woman should have a slightly higher intake of iodine. In some cases, if the mother is suffering from hypothyroidism, okay, a doctor may give her the supplementation of iodine. Okay. And also a breastfeeding mother, okay, iodine can be given to the child through breast milk also, just like vitamin B complexes. Okay, through breast milk iodine can also be transferred into the child. Okay, so you have to after pregnancy, mothers have to still monitor their iodine intake if they are breastfeeding, if they're lactating. Okay, because that amount of iodine will be going to the child as well. So you have to make sure, a lactating mother, a breastfeeding mother has to make sure that she is neither deficient nor she is going to a level of toxicity, because that will affect the child also. If the mother is deficient, the child will be deficient. If the mother is consuming too much of iodine, the child will also get that toxicity. Also, it improves the cognitive function during pregnancy, and also in childhood. If the mother was having healthy amount of iodine, the child will develop with a healthy neural tube, and even after birth, the child will have good cognitive function. Okay. Any intellectual risk of intellectual disability will be low. And also now some research is going on about iodine, how it can affect the treatment of breast cancer in women. Okay, how is it possible for iodine supplements to help treat certain forms of breast cancer? It is still under research. Okay, we can't conclude it that iodine can tackle breast cancer, but it is under research. Okay. And also iodine is used in disinfecting water as well. It is one of the method of disinfection. Okay. Even in hospitals, you would know the betadine solution and all. Okay. Povidone solution, betadine solution. It is used to if you get wounded. Okay. This iodine ointment is applied. Okay. That is a really good antiseptic. Okay. So just like that, iodine is used in water disinfection also. 2% of liquid iodine tincture can be added into water, and it can disinfect the water. Iodine tablets are also used for this disinfection. Topical application of iodine, as I mentioned earlier. Yeah, for gargling for throat infection, that betadine solution, you can put it in hot water, lukewarm water, few drops, and then you can gargle with it. Okay, so that can cure your throat infection. And topical application of iodine, that it povidone solution or creams and all betadine solution. If you apply it topically wherever there is a wound, okay, you get hurt, there is a bleeding, apply it. It acts as a really good antiseptic. Animal bites, burns, deep cuts, okay, in that it should not be used. Other kind of mild wounds, scraps, etc., surgical wound also, if there is any stitch, any stitching has been done in that area also, betadine can be used. But for animal bites, if there is a burn injury, and if there are any deep cuts, okay, deep cuts that goes up to your bone and all, in that cases, avoid using betadine. Okay. So absorption and metabolism of iron through diet is what you get majority of your iodine. Okay. Through your GI tract, your small intestine, iodine is absorbed. Okay. And this inorganic iodine circulates in your blood. Majority of it uh, is being taken out from your body through your kidney, but whatever remains, okay, that goes into your thyroid gland. 80% of the inorganic iodide that remains in your blood, 80% of it goes into the thyroid gland. Okay. So whatever iodine you are having in your diet, okay, the amount of iodine that you get from your diet, 90 to 95% of it is leaving your body to your kidneys. Only 5% of it remains back. And out of that 5%, 80% of it is stored in your thyroid for the production of T3 and T4. Remaining circulates in your blood, is stored in the muscles, saliva, bones, etc. Okay, so this is how iodine is absorbed and metabolized in your body. Majority of it is lost in your through your urine. Okay. So this is the way how T3 and T4 are produced. Not just your It's not just dependent on iodine, but it is also dependent on other endocrine glands like hypothalamus and pituitary. Okay. Hypothalamus and pituitary glands are located near your brain. Okay. These hypothalamus is also an endocrine gland. It secretes hormone. So hypothalamus will secrete the TRH hormone. That TRH hormone will uh, give the message to the pituitary gland to secrete TSH hormone, thyroid stimulating hormone. Okay. And then once the TSH hormones is being secreted, only then the thyroid gland will start producing T3 and T4 in the presence of iodine. Okay. So for the production of T3 and T4 thyroid hormones, iodine is required plus TSH, thyroid stimulating hormone, is required. Okay. Only if you have iodine and your endocrine system is not producing enough amount of TSH or TRH, thyroid hormone production will not take place. Okay. So these are the other faculties involved in the production of T3 and T4 thyroid hormones. Okay. TRH secreted by hypothalamus, TSH secreted by thyroid stimulating hormone secreted by your pituitary gland. Okay. Thyrotrophin releasing hormone, thyroid stimulating hormone. These are the two hormones. It has to be released. Only then it will work on thyroid gland. In the presence of iodine, T3 and T4 will be synthesized and it will be released into the blood circulation. Okay, and that's how your body metabolism is maintained. Overall body metabolism is maintained. Is it clear to all so far? Coming to recommended allowances, RDA. TRH means thyrotrophin releasing hormone. Thyrotrophin. Coming to RDA, how much how much iodine do you require on a daily basis? That is RDA. So it is estimated between 50 microgram to 1000 microgram. That is the healthy limit. Okay, at least 50 microgram, and the upper limit is 1000 microgram. If you go beyond 1000 microgram, it is toxicity. Okay, even if you go to 1000 microgram, your kidneys are capable to enough to remove majority of it, because remember, out of 100% of the iodine that you have received from your diet, 90 to 95% of it anyhow is going to be excreted out of your body through your urine. Only 5% of it remains back. Okay. Adults, it's around 140 or 150 microgram per day. That is also used. In India, RDA in India is 140. Internationally, it can go up to 150. Okay. Pregnant women, 220 microgram per day. In all the major sources, even internationally and even in India, 220 microgram per day has to be taken. So pregnant women just have to take a little bit more salt. Okay, 2 pinch more of salt has to be taken. Okay, except for the situations in which if a pregnant woman is suffering from PIH, okay, low sodium salt can be used. Low sodium but iodine fortified salt can be used. Okay. Lactating mothers, 280 microgram. They have to use a bit more iodine because through breast milk, iodine goes to the child's diet as well. Okay. Children under the age of 8, 1-year-old to 8-year-old children, 90 microgram is required. But when they grow older, okay, from 9 to 13 years of age, 120 microgram is required. Okay. Teenagers and adults require the same amount, that is 140 microgram. Teenagers and adults require the same amount of iodine, that is 140 microgram. But in children up to the age of 8, 1-year-old to 8-year-old, 90 microgram. Okay. 9-year-old to 13-year-old, just before your teenage. Okay. 9, 10, 11, 12, 13. This age group will require around 120 microgram. Okay. Teenagers and adults will have the same amount. Pregnant women, a little bit more. Okay. 2 pinches extra of salt. Lactating women, they have to eat a completely one extra meal. Lactating women have to have. Okay. So in that, the salt requirement is considered. So they don't have to eat additional salt. Women who are lactating, they just have to have one extra meal. Okay, in that one extra meal, whatever iodine content their body requires, okay, in satisfactory amount of salt consumption, that requirement is also taken care of. Okay, so that is the RDA. Is it clear to all? Sources of iodine. Seafood, okay, are the rich sources of iodine. Eggs, dairy products, vegetables, and iodized salts. Okay, vegetables are not a good source of iodine. Okay, because when you wash the vegetables, also iodine is lost. If you cut the vegetables and then wash it, steam it, boil it, iodine is lost. Okay. So vegetables are not a good, great source, and even the iodine from vegetables are not that easily absorbed by the human body. Okay, because the content of fiber is also there. Vegetables do have fiber. Okay, a lot of iodine will get lost in the fiber mesh that is created in your gut. Okay, so vegetables are not an ideal source. Okay, seafood it is. Seafoods are not fiber rich. Okay, they are just protein. So yeah, through seafood also iodine will be secured. Eggs, dairy products. Okay, iodized salts definitely, fortified salts, any form of salt, pink salt, rock salt, table salt. If it is fortified, it is better. Okay, just give me 1 minute. If you are having too much of iodine, that also leads to toxicity. Okay, too much iodine will cause nausea, vomiting, diarrhea, fever, burning sensation in your mouth, throat, stomach pain. In some severe cases, it will go into a situation of coma. Okay, the person will become unconscious. So coming to iodine deficiency disorder, IDD. Okay, it's a spectrum of diseases. Okay, about 1.5 million population. So not million population. The population number is much more than that. It's not million, it's in billions. Okay. About this much population in the world are at risk of IDD, and out of that, 200 million are in India. So in India, we have a population of 1 billion people, more than 1 billion people, but 200 million people in India are already at the risk of iodine deficiency disorder. Okay, but it is not that common. Iodine deficiency disorders are not common in um, Western countries, okay, because they have implemented water, iodized water. Okay, they use iodine in disinfection of water. Okay, a lot of their food is fortified with iodine, and also in developed countries, they have eliminated the problem of goiter or iodine deficiency disorders. Okay, but in India, it is still under work. Okay. So the prevalence of goiter is more in children who are between the age of 6 to 11 years. That is around 4% of our population. And highest risk is seen in Maharashtra. 11.9% of the cases of iodine deficiency disorders is found in Maharashtra. And in West Bengal, it is 9%. Okay. But always remember, wherever you have these hilly regions, almost each and every state in India, okay, there are some mountain ranges. Okay, so from take any state in India, okay, we have some or the other ranges, and the population who are in these mountain ranges will always be at risk. Okay, as compared to the people who live near the coastal regions. Okay, people who are living in the mountain regions, hill regions. Okay, even if it is in the same state. Okay, for example, if you take the state of West Bengal, okay, they have a coastline. West Bengal has the Bay of Bengal coastline. They have the ranges also, like Siliguri, Darjeeling. Okay, that's the ranges of the same state. Okay, but still prevalence of goiter will be there in the hill ranges, the mountain ranges, not in the coastal line. Okay, if you take the state of Tamil Nadu, okay, it also has the coastline, but it also has the Nilgiri ranges. Okay, so population who comes in the Kodaikanal Nilgiri ranges, they are prone to goiter. Okay, it applies to each and every state. Okay, apart from the states who have the coastline, the states who are in the mainland India, okay, like Madhya Pradesh, Jharkhand, Chhattisgarh, okay, Rajasthan, okay, they don't have coastline, but Rajasthan and all, they still have the Aravalli ranges and all. So people living there, they have a high risk of goiter, okay. And with every rainfall, every monsoons, the soil will get eroded, okay, because in mountains the soil erosion is at a higher rate as compared to the plateau lands, valleys, okay. Soil erosions are at a higher rate in mountain ranges during the monsoon seasons, okay, because the soil will pour down, it will just drift away with the rainwater. So a lot of minerals from the soil is also lost with that. So causes of iodine deficiency, you have environmental factors, that is where you live, okay, the place of your like as I mentioned, mountain ranges. If you're living in the mountain ranges, that is another cause of iodine deficiency. Not having enough amount of access to fortified iron, okay, certain rural communities, they still don't use fortified iron, they use rock salt and all. After the rain cycle, whatever crops you grow in soils which has been eroded, that crops will definitely be low in iodine, okay. And humans and animals who are consuming the food grown in low iodine soils, they are deficient, okay. And low iodine soils are very much common in inland regions, that is the states which do not have coastal line in India, okay. The states which do not have any coastal line, okay, the Arabic Ocean, Indian Ocean, or Bay of Bengal, okay, the states who do not have this coastal land, those are the states we call the inland states, okay. So people who live in the inland states, mountainous areas, and also the areas where a lot of flooding takes place, like Assam and all, okay, Assam, Odisha, okay, a lot of flooding takes place in these states, okay. So that can happen in coastal regions also. Odisha has a coastline, but still the state is prone to a lot of floods, okay. So that is also a risk factor, external risk factor. Intrinsic factors are it's the in the human life cycle itself, okay. During the fetal development, if the mother was deficient, okay, maternal malnourishment, that would lead to fetus growing in an iodine deficient body, okay. So the child may develop from the birth itself, the child will be deficient in iodine. And and after birth, if the child is not getting enough amount of iodine supplements through food, diet, okay, breast milk, then again the risk will be enhanced and it will lead to some form of deficiency disorders, okay. Hypothyroidism and all, it is genetic, okay. Female relatives, the first line of female relatives in your family, if they have thyroid issues, there are high chances the daughters who will be born in that generation will also have the risk of developing thyroid issues. So that is a genetic factor which is intrinsic, okay. Diet that is low in iodine, any malabsorption, okay, if you are suffering from malnourishment, okay, or any stomach cancers, intestinal cancers, Okay, so even if your diet has enough amount of iodine, that is not being absorbed properly. Okay, so that is an intrinsic factor, something going wrong inside your body that is not allowing enough amount of iron absorption. Thus, you got the iodine deficiency. So iodine deficiency in children, we have cretinism. Okay, I'll show you the images of cretinism. There are different forms of cretinism. In adults, it is called goiter, okay, or hypothyroidism, or any psychomotor defects can also take place in adults. Okay, goiter, hypothyroidism, psychomotor defects like impaired mental function. Okay, not able to do math properly, simple math. Okay, memory issues. So those things, and psychomotor other defects, like if you ask them to catch a ball, they cannot. Okay, they are simple throw and catch game. They cannot play that properly. Okay, their hands may undergo tremors, that is shakiness, like they're extremely cold or something. The way how the hands and fingers shake. Okay, that can also take place. In children, because of cretinism, they may have retarded physical development, impaired mental function, low IQ. Okay, children who suffer from cretinism. They may be born with some congenital anomalies. If during the fetal life, if they were suffering from deficiency, the child may suffer from some congenital anomaly, like they may not have anencephaly. Okay, that is absence of the skull. Okay, the upper part of the skull. Microcephaly. Okay, small head, born with very small head. Okay, spina bifida. These things can happen if because these are also the neural tube defects that can take place because of iodine deficiency, as well as B complex deficiencies, folic acid deficiency. So goiter is the enlarged thyroid gland. You can see here, this is where the thyroid gland is. If it is enlarged, swollen, okay, that is what we call as goiter. Okay, it is non-neoplastic, which means it is not usually cancerous. Okay, goiter is not usually cancerous. It is just enlarged thyroid gland. Okay, because the thyroid hormone that the gland is producing is not sufficient. Okay, so thyroid gland thinks, if we have more cells, if we become more, we have more cells, and if we have bigger cells, we can make more thyroid hormone. Okay, so in that situation, the thyroid gland proliferates. Cell proliferation takes place. Lots of cells are produced in the thyroid gland, and bigger cells are produced, and that's how you get enlarged thyroid gland. Okay, to combat hypothyroidism. And it happens when there is not enough thyroid hormone that has been produced. That's when the thyroid gland starts swelling up. Or you may have excessive thyroid stimulating hormone. Okay, because TSH, if you remember, it is produced by your pituitary gland. The hypothalamus will secrete TRH, thyrotrophin releasing hormone. TRH will enable the pituitary gland to secrete TSH, thyroid stimulating hormone. So in the name itself, thyroid stimulating hormone. Okay, you know what this hormone will exactly do. It will go on stimulate the thyroid gland, produce more thyroid hormones. Okay, the message the thyroid gland will continuously will get is to produce more thyroid hormones. Okay, so that is over. Too much of TSH, that is also harmful. Too much of TSH in your system will make your thyroid gland to produce more thyroid cells, so that it can produce more thyroid hormone. Okay, so that's how it develops into um, a goiter. increase your T3 and T4 if you're suffering from hypothyroidism, directly levothyroxine tablets are given, which are hormone replacement therapy. Okay. To maintain the production of T3 and T4, taking iodized salt, fortified salt is enough. Okay, for maintenance. Thyroid tablet can be taken during pregnancy. A pregnant woman, if she is suffering from hypothyroidism, okay, her blood work will be taken, okay, based on the iodine levels that are in her blood, based on her thyroid panel test. Thyroid tablets, okay, levothyroxine tablets will be prescribed. It is completely safe for a pregnant woman to take thyroid tablets during pregnancy. Okay, she has to be a bit cautious. She should not overdo it. Okay, otherwise it may go to toxicity. The fetus may also suffer from it. Okay. Pink salt, if it is fortified with iodine, it can be used by a person who has thyroid issues. So this is how a goiter looks like. This is a normal thyroid gland and an enlarged thyroid gland. Okay. Because of this enlargement, okay, there is an excessive pressure that the thyroid gland will now put on your esophagus and your trachea. Okay, that is your windpipe and your food pipe. So you will have breathing difficulties. You will have difficulty in swallowing food as well. Okay, so those are the side effects of having goiter: breathing difficulty, swallowing difficulty. Okay, not able to sleep properly. While sleeping, you can't breathe properly. Okay, because the weight of the goiter and large thyroid gland is on your trachea, so you can't breathe properly. And incidence, the prevalence of goiter is more common in adolescents, teenagers, young adults, and school age children. Okay, school age also 6 to 11 years of age. Okay, that is the high time in which kids are usually affected with goiter or low thyroid function. And more women are affected as compared to males. Okay, it's the statement is wrong here. More females are affected than males. Okay, it's very prevalent in women as compared to men. Here you can see cretinism. Cretinism happens because of severe iodine deficiency during pregnancy. Okay, the during pregnancy, when a woman is severely deficient in iodine, she gives birth to a child who suffers with cretinism. Okay, and there is a high risk of fetal mortality or prenatal mortality. Okay, either the child will pass away, there will be a chance of miscarriage, okay, spontaneous abortion or miscarriage during pregnancy, or increased risk of stillbirth. The child may be born without life. Okay, and also the child's mortality rate is also quite high after being born. That is cretinism. Okay, that is a severe deficiency of iodine, congenital iodine deficiency, because the mother was deficient in iodine. It is called as cretinism. Congenital means born with it. Somebody was born with this disorder. It's a congenital iodine deficiency syndrome. Okay, that is cretinism. It is present at birth and it is marked by physical and mental impaired physical and mental development. Okay, so why? Because insufficient thyroid hormone. Okay, hypothyroidism. The child is born with hypothyroidism. And usually, if the mother was malnourished or she was severely deficient during her pregnancy, this give rise to a child with cretinism. Okay, so some signs and symptoms here. The child may have a very short stature. That is, the child will not have much height. Okay, child may be deaf and mute. okay, not able to hear properly, can't speak, okay. Cognitive functions are affected. Dry hair, dry hair that is very dry, coarse, and very sparse. Okay, very thin hair. You can actually see the scalp of the child as well, and it is very lightly colored. It is not dark hairs. Okay, lateral eyebrows that are thin. The sides of the lateral eyebrows means the sides of the eyebrows, end of the tail part of the eyebrows are extremely thin. Okay, some thickness will be there in the starting phase of the eyebrows, but when it tapers into it, it will taper into a very thin line. Okay, periorbital edema, that is around the eyes. Okay, that is the orbital region around the eyes. It's always swollen. Okay, puffy, dull face with very dry skin. Okay, these are the signs and symptoms of cretinism. So what are the causes of cretinism? Lack of thyroid gland. Some children, they, because of the deficiency of mother's diet in iodine, thyroid gland itself is not developed. Okay, and the failure of thyroid gland to produce thyroid hormone. Either the child will not be born with thyroid gland or an underactive thyroid gland, or the thyroid gland will not produce thyroid hormone. Okay, that is one cause. Second is iron deficiency in diet. That is endemic cretinism. Endemic means there are certain patches of land across the world where cretinism is very common. Okay, and there are high chances that these patches of land are high peak areas in mountains like Leh, Ladakh, and all. Okay, endemic means it is very common. Cretinism is very common in this locality. Okay, so that is endemic in that state, town, district. Okay, cretinism is very common. Okay, so it is because of some environmental factors that children are born with cretinism. Okay. Yeah, there is a mild to moderate rate of cretinism as well. Okay. So here, different types of cretinism, neurological cretinism and myxoedematous cretinism. So neurological cretinism, from the name itself, we can understand it will affect the neural functioning of the child. Okay. Mental retardation will be there. The child will be deaf, mute, and also the child will have squint eyes. Okay, strabismus, squint eyes will be there. And the child will not be able to stand properly when the child develops. Okay, the child will not have that gait, balance. Okay, we have a gait that is a balance. Okay, we know where our center of gravity is. The body knows the center of gravity, and because of which it can stand. Okay, we can stand, we can move around, walk. Okay, children who have this neurological cretinism, they cannot balance themselves. Okay. Again, neurological cretinism happens when the pregnant woman is not taking enough iodine. Maternal hyperthyroidism can also cause neurological cretinism. Again, there are regions in every countries where there is a high rate of neurological cretinism as compared to other areas of the country. Myxoedematous cretinism, in which the name itself you have edema. Okay, so there is high levels of swelling. Okay, this is in this condition also, the person who is suffering from cretinism, they will be admitted in the ICU. Okay, it is a condition in which extremely low amount of thyroid functioning is there. There is negligible amount of thyroid functioning. Okay. Or hypothyroidism, if you are not treating it, okay, not able to treat hypothyroidism or not continuing the treatment of hypothyroidism, that will lead to myxoedema, edematous cretinism. So it is the extreme end of hypothyroidism. Myxoedema is an extreme end of hypothyroidism. There will be extreme swelling on the face. Okay, your lips, eyelids, preorbital area will be so swollen up that it feels like your eyes are shut. Okay, tongue is also swollen. Thickening of the skin everywhere in your body because of swelling. Okay, especially in your lower legs where lymphatic drainage is low, your lower legs, your ankle, okay, it will be completely swollen. It is an emergency situation. It's a medical emergency. If you are not taking this patient who is suffering from myxoedematous cretinism, they may die. Okay, so it is a medical emergency. And it's an advanced case of hyperthyroidism, life-threatening condition. And if it is not treated, the person will go into a stage of coma. That is what we call as myxoedematous coma. Okay. High blood pressure, heart rate that is too low. Okay. They cannot withstand cold. Okay. At all. They are very, because their hair is very thin, very brittle. They cannot withstand cold at all. Low energy, lethargy. Okay. All of they're always heavy because of the water retained in their body. That is myxoedema. Constipation, depression. Okay. These are seen in myxoedema. And oxygen levels in the blood is very low. When you check the SpO2 levels, oxygen levels in the blood is very low. Sodium levels also, when you do the laboratory test for the blood sample, sodium levels are also very low. And there is high level of carbon dioxide in the blood. And the risk of person going into coma, or the person may have convulsions, seizures. Okay, the person may go into a state of fits. So in treatment, immediately levothyroxine medication is used to treat these patients. They will be admitted into hospital for a few days. They will be put on levothyroxine medication. Okay, that is the clinical treatment of it. When the symptoms become manageable, they will be sent back home. But there are high chances that this person will be put on medication like levothyroxine for life. Okay, lifelong they have to continue the medication. Okay. So neurological cretinism, as I mentioned earlier, it has these conditions like retarded growth. The child will not have a proper height. Okay, they will have a short stature, deaf, mute, motor spasticity, that is their motor functions. Okay, they will not have a grip over things. Okay, their muscles will not contract properly, that is motor spasticity. And severe mental retardation along with the squint eyes. Okay, eyes that are squint, like eyes looking at different directions, pupils looking at different directions, that is neurological cretinism. Myxoedematous cretinism, here also the child may suffer from retarded growth, incomplete maturation of facial expression, that is child is born with certain reflexes, that reflexes will not be seen as well. Thick and dry skin. Why the skin is thick? It is because of edema. Okay, small dry hair, small eyelashes. Okay, no eyebrows at all in some cases. Mental retardation is less as compared to neurological cretinism. Okay, children who suffer from myxoedematous cretinism, they may or may not be mentally retarded. But in neurological cretinism, mental retardation is a symptom. Okay, here it can be, cannot be. Okay, it may happen, may not happen. Mental retardation. Okay, and also delayed sexual maturation. They will hit the puberty much later as compared to their age group. And all the other manifestations of hypothyroidism we had discussed earlier: edema, gaining weight, cold intolerance, okay, low BP. These things are very common. All the signs and symptoms of hypothyroidism will be there. Hypothyroidism or underactive thyroid gland happens when thyroid gland does not make enough thyroid hormones to meet the body's requirements. Okay, and it is very common among adults, women as especially. And those who suffer from hypothyroidism, they have dry, coarse skin, husky voice, delayed tendon reflexes, okay, edema in their body, risk of gaining weight, okay, low metabolism, lethargy, weakness, low BP. These things are seen. And how do you diagnose hypothyroidism? T4 is low, T3 is normal, but TSH levels is high. Okay, TSH levels, when it is high and T4 levels are low, it means the person is suffering from hypothyroidism. Okay, because too much of TSH levels means thyroid is not producing enough thyroid hormones. That's why pituitary gland is overdosing the thyroid gland with TSH hormones to make more, to produce more thyroid hormone. Okay, so that is a sign that the person is suffering from hypothyroidism, because thyroid gland is underactive. That's why pituitary gland is dumping a lot of TSH hormones, okay, to make the thyroid gland function. Even if the TSH gland is TSH hormones is high, that is also a sign of mild hypothyroidism. Okay. Psychomotor defects: poor IQ score, poor motor coordination. Okay, the hand-eye coordination. Okay, the left foot, left leg, left hand coordination, right leg, right hand coordination. Okay, these are the poor motor coordination examples. IQ score will be less. Those are the psychomotor defects of thyroid deficiency. Impaired mental function, reduced mental function, low intelligence levels, lack of feelings, okay, apathy. They have a sense of apathy towards others. Okay, they don't feel intensely in any relation for that sake. Okay, even with the parents, they don't have a good relation. Okay, because they lack emotional cognition as well. Okay, emotional intelligence is also quite low in them. So that could be translated into apathy, lack of a sense of oneness with the family or friends, lack of initiative or decision making capacity. Yeah, these things come under impaired mental function. That can also happen because of low thyroid levels. Prevention: we have the National Iodine Deficiency Control Program. This is a nutritional program. Okay. Uh, First, it was a National Anti-Goiter Program. That was some other name, National Goiter Control Program. But now it has been changed into, the name has been changed into National uh, Iodine Deficiency Disease Control Program. Okay. So in India, it was started in the year 1960 as National Goiter Control Program. Later, the name is National IDD Control Program. And since April 1992, this program with this new name has been implemented by the Department of Health under the Government of India. They have the objective to bring the iodine deficiency disorders under 5% in the country. Remember, 200 million people are at the risk of iodine deficiency diseases in India, 200 million people. So the goal of this program is to bring that prevalence rate to less than 5%. And also to make sure, this is important, the program has this goal to make sure that at every household, there is 100% consumption of adequately iodized salt. Okay, that is 15 particles per ppm. Okay, so that is the second goal, to make sure that every household has access to fortified iodized salt. They also do a lot of surveys to make sure to understand what is the magnitude of iodine deficiencies in different districts. Okay, because as I mentioned earlier, there is no state in India that is free from iodine deficiency. Each and every state in India, the way how India's geography is, every state in India has hill ranges and mountain ranges which has settlements of people. Okay, so continuously we have to check what is the magnitude of iodine deficiency. Okay, how far we have come. Okay, that has to be checked. In every district, it has to be checked. At district level, we should know. Okay, not at the state level. At district level, we should know which districts are at the highest risk of iodine deficiency. And make sure that there is a supply of iodized salt. In place of common salt, iodized salt supply should be there, even in the tribal communities. Okay. Resurveys will be done in every 5 years. Okay. Resurveys will be done in every 5 years to check the iodine deficiency disorders in India. Okay. Laboratory monitoring of iodized salt and urinary iodine excretion. Some samples, okay, the ASHA workers, community health workers will go into different districts, okay, collect the urine samples, excreta samples from the people, okay, rural people or urban people, and these samples will be tested in the laboratories, public health laboratories, okay, to understand the magnitude of iodine deficiency. Health education and publicity through various media channels, newspapers. In advertisements, you will see each and every salt advertisements you will see. They will specify on this fact that this is an iodine fortified salt or this is a double fortified salt. Whatever salt advertisements you have seen on TV, on social media, there is a focus on fortification. Okay, now it is iron and iodine fortification. But if you remember some old salt advertisements, it is iodine fortification. Okay, but now it is double fortified. So these are the, but this program has been successful as well. The total goiter rate in our country as compared to the past 2 decades has come down significantly. Okay, the number of goiter cases that we had in the 1990s as compared to now, it has come down significantly. Salt monitoring, urine monitoring is done in every state and union territory to make sure to understand what is the level of iodine deficiency in India. So with that, we know that what is the endemic goiter rate in each of the states. Gujarat, Tamil Nadu, Uttar Pradesh, these are the states which have the high, and also Maharashtra, Gujarat, Maharashtra, Tamil Nadu, and Uttar Pradesh, as per the data, they have the highest endemic goiter rate so far, which is more than 5%. Okay, more than 5% of the population are in the endemic goiter rate. And these are the states of Gujarat, Maharashtra, Tamil Nadu, and Uttar Pradesh. These 4 states have the highest endemic goiter rate as per the data of 2015 to 16. So you don't have to study in detail about the National IDD Control Program in detail. Just know the objectives. Okay. Don't need to by heart the objectives. Okay. Surveys are important. What kind of surveys do? They check the salt. Okay. Each and every company which has the license to produce salt, their salt samples are checked frequently to see if they have the designated amount of fortification, that is 15 parts per million. Okay. 15 ppm is the iodine for iodized salt fortification level that is used in India, 15 parts per million. So every now and then, whichever companies have the license to produce salt, I produced iodized salt, iodine fortified salt, their samples will be collected regularly to check if they are within this limits. Okay. And also the urine samples, excreta samples of the people living in endemic goiter regions, their urine samples, excreta samples will be checked regularly in public health laboratories, which are funded by the government. Okay. In these laboratories, it is checked to find out the current statistics of iodine deficiency disorders. So iodine fortification is the main component of this program. Monitoring and surveillance, as I mentioned, salt surveillance, urine sample surveillance, manpower training, that is usually the community health workers, okay? Community health workers, PHC, CHC workers, they are trained on how to reach certain communities, reach out to certain communities, ask them about their knowledge about iodized salt, collect urine samples from them. Okay, so that all comes under manpower training. Even training the student nurses, student doctors, okay, during their community health postings, training them on how to collect goiter-based information. Mass communication, that is the use of social media, uh, the national telecommunication networks, all India radio. Okay, through that, the importance of using iodized salt instead of common salt is focused on. Okay, so these are the main components of this National IDD Control Program. So that's about iodine deficiency.